Our organization, my hospital, as well as probably most hospitals around the country, had to quickly shift to other staffing models when COVID came and the pandemic came, out of just pure necessities to survive, right? Most folks were using external or third party agencies, which of course are contracted service. Most often those nurses are coming from far away. You're not usually using local support. So nurses are taking usually a 13 or 16-week contract. They may be, I'm in St. Louis, they may be coming from Florida or from California or somewhere pretty far away. They're doing their contract, they're exiting. And that creates, although a short-term solution, you have a staff and a nurse at the bedside, it creates some long-term challenges, not only with cost, but just around longevity, loyalty, sustainability for outcomes. So we really switched to look at what an on-demand model might look like. We've partnered with ShiftMed, and for us, that partnership is really important because they truly are a partner. So having a partner that shares your vision, your mission, your values, wants the same outcomes as you. And that really turns then into a staffing model that is a long-term solution. It's more cost effective. It helps with regards to being able to flex those nurses as needed. So rather than having a 13 or 16-week contract with a nurse, which you may have that need, you may not have that need as things are changing in your hospital. An on-demand model gives us really the ability to adjust our staffing needs very quickly, use nurses when we need them, flex them maybe offer to other areas when we don't need them. So that gives us a lot of flexibility. It also created, again, a lot of sort of loyalty and longevity with these nurses. They're local nurses. St. Louis is a pretty small town, believe it or not. So everybody knows each other. Healthcare is a small world, and so generally you're getting local nurses. So they're from the area. They work in other markets around here. Folks know each other, so it's nurses, have those relationships. They're helping to sort of recruit and sustain one another. So that breeds again that loyalty and longevity. And you really get into kind of a situation when you're in a dual job interview for some length of time. So you're getting this wonderful on-demand support that they understand the market. They're there to support your ministry. They have relationships with your own staff, and then again, you have the opportunity to really kind of attract them to be hopefully a permanent part of your organization.